Councilmember Fournier, thank you for coming to our ELN studio.
Absolutely, thank you for having me.
What is the state of early childhood learning in Portland, Maine today? Maybe give me both pre-COVID and what's happened since COVID.
Sure, I think pre-COVID, just like a lot of places around the country, there's just not enough spaces. And so we have so many parents that need childcare to work to make their household work so that they have money coming in. Plus, we also know the benefits of children being around each other socially, emotionally, being able to build their communication skills, learning how, to create a community. And when you don't have all those spaces, you have children that really start to fall behind, especially as they enter public school. So I think before COVID, we definitely had a shortage, but there were lots of small, family-run childcares or in-home childcares, as well as lots of different centers. And I think what we've seen post-COVID is a significant decrease in those programs, whether the parents that would come and work in them couldn't go back to the workforce because they themselves couldn't find childcare, or we know that also early child care workers are some of the lowest paid in the country. And so you're coming out of COVID, you're like, my bills are behind, I need to pay my mortgage, I need to pay my car, and the job that I'm doing isn't cutting it anymore because I'm so behind. And so you have a lot of people that have also left the workforce to go find something else that's paying more. So I think for Portland, we're very much feeling that. And what I hear on the council from a lot of families is, we need more spots, we need more childcare, or these children are just going to sit at home, and then all of a sudden they show up one day in kindergarten and they don't know how to interact, they don't know how to engage, and then I think you start to see, well, that child's a behavior problem, or that child,
it all
is
connects.
Going to be tagged. Yeah, absolutely.
It all connects.
It's critical.
So, you seem to be an extremely busy person. One role is council member. Can we talk about another of your roles?
Yeah, absolutely.
You currently are in a grant-funded position that provides barrier-free support to families within a pediatric practice setting.
Yes, yeah.
What is the program? What do you do in it? And what do you see there?
Yeah, so I'm an early childhood support specialist within the outpatient pediatric clinic. And so we see typically families who either require free care or low-cost health care or Medicaid. So we have very few families that are, private pay insurance. So these are often families that are living in poverty, or within Portland, we have a lot of asylee families that have just newly arrived into the States. And so my role is to help provide that connection. So pediatricians can spend 15 to 30 minutes often with a family, and they're really focused on the medical component. Then they have to go off to their next patient.
Yes.
But that doesn't mean that, they've been able to address some of those social determinants of health, like, do you have safe and secure housing? Do you have enough food to feed your family on a regular basis?
So does the family start with the pediatrician and then transition to you?
Yeah.
So it's almost two separate, though connected conversations.
Yeah, so I often will come in after the visit, so the pediatrician does their visit, and then we have a quick little conference before I go in and talk to the family. And so that could be, hey, so mom mentioned that she's working with this domestic violence agency to get some counseling because her and dad were separated. Or this mom mentioned that she's really struggling to get diapers on a regular basis. The baby has a diaper rash because she's trying to use diapers for longer periods of time because of that insecurity. And so by having that quick little conference, I know what I'm walking into, so I'm not asking the same questions to the parents who are like, I just told the doctor all this information.
Yes.
So one, it's kind of honoring that time for the family, but also jumping into the conversation that is most important for them.
And you can really cover a wide range of risk factors.
Absolutely.
And I understand you collect data off of these conversations as well.
Yeah, absolutely.
What do the data show? What have you seen?
So the things that we're looking at is, as we're having these conversations, are they identifying, a housing need or a social services need or diaper insecurity, food insecurity, or is it just, it's a brand new mom who's 19 years old and is trying to figure out, I don't know how to bathe my baby. I don't know, how to do sleep routines, or I'm not sleeping. So it's really taking this holistic look at how do we help this family be successful so that as this child develops, as this family develops, they have the best possible outcome. So I'm taking data, asking questions, and then we're able to pull that from our medical record system to see we met this family when the baby was 3 days old. Now the baby's 4 months old. What sort of progress has this family made with this intervention? And it's amazing what we're seeing. We're just seeing really, really great results. They're not diaper insecure, or they've been able to connect to community resources that help them with housing or getting connected to WIC or even just getting health insurance. So they're not getting these bills from the hospital that create anxiety and fear and I don't know how to pay this. So it's helping connect all of the things for the family to help them be successful.
In learning about your story, I realized as well, this is personal for you,
Absolutely.
isn't it?
Yeah.
I mean, you underwent quite a career change.
Yes.
Inspired, I believe, by your son.
Yes, yeah, absolutely. So I was on a trajectory with an insurance company, in the financial services industry to be like project manager or, operational development
Or
and
CEO of a multinational bank. Yeah, something.
one day. And so my youngest son, I had twins, so I actually have 4 children, but the youngest are twins. And we noticed around age 2, they weren't exactly developing the same. So, they had some language development, but he was starting to do things like lining things up, or he would get really frustrated and hit himself or bang his head off the ground. And it was just I have no idea what's happening with this kiddo. It just doesn't make sense. And so the pediatrician did some screenings for autism and said, well, let's go ahead and do some evaluation because he's really kind of hitting all these different flags. And so after going through that evaluation, he was diagnosed with autism. And it was I have no idea what to do.
Yeah.
And so thankfully, Maine has a program called Child Development Services that comes in to do early intervention. So it's really around teaching parents how do you work on your routines so that you're able to bring language out or create social connections within the scope of your everyday life. Not every parent can take time off to do all of this development. So how can you do it within what you're already doing? And so in watching his transformation, his language development, he started to come back to us and be like,
Wow.
hey, so,
Wow.
I'm checking back into my family and I'm learning these things and we're seeing less, aggressions or less self-harm. Why wouldn't you want to do something that's going to do that for children? And just what it did for our family was incredible. So rather than going to graduate school for project management or financial services, I went to graduate school for early childhood special education.
A different kind of education.
Absolutely.
And
yeah.
one both in school, in the classroom, but also in real life.
Absolutely.
A full
And so then in doing different roles, I worked doing in-home services for families who have a child with autism. How do you connect them to community? How do you plan a grocery trip knowing that you're going to have tantrums or knowing that you're going to have, behaviors that happen? How do you help families meet their goals? I taught in a special education classroom and I worked connecting families into that transition to kindergarten, and how do you work with public schools on implementing special education services, and then worked in Head Start. So kind of lots of different facets to figure out how do we most help these families within our community.
Councilmember, what does it mean to you to be an Indigenous Diné woman on the City Council? What level of responsibility does that make you feel?
I'm honored to hold that space. There are, so many people that came before me to make it possible, not necessarily in Portland specifically, but on, a national level back in my homelands, being able to see Deb Haaland, Secretary Haaland as, part of the cabinet. It's just incredible. And so by claiming these spaces and creating spaces for Indigenous officials to walk into, it just allows us to have the next generations come along with us. So my children are seeing me run for city council, or they're seeing me, take advocacy space, or they're seeing me take pictures in Washington, in our capital doing this work. And so I think when you're a minority or when you're part of a marginalized group, it's hard to walk through some doors. And so if you see someone who looks like you, has the same type of life experience, has a similar identity, it's so much easier and comfortable to walk through that door and take that space as well. And so I'm, again, incredibly honored to be in this space. I take my responsibility, very, very seriously, and I am just so excited to do it.
I'm sure that you do. I'm sure that you are. Your children see you. Your community sees you.
Yes, yeah.
Thank you.
Of
Thank
course,
you for
thank
the
you.
work you do and for coming to the studio.
Awesome. Thank you for having me.